Princeton Theological Seminary. He graduated from the seminary in 1878. But on November 3rd of 1918, he offered an impassioned sermon titled, "Some Reflections Growing Out of the Recent Epidemic of Influenza That Afflicted Our City." This is a copy of that sermon. And Reverend Grimke was the pastor of the 15th Street Presbyterian Church, the historic 15th Street Presbyterian Church in Washington, D.C. And as the pastor, he reflected upon how the Spanish influenza, the Spanish flu had impacted the community that he was a part of. And in his sermon, he describes how the schools were closed and how there were orders to shelter in place and to maintain safe social distancing by government authorities. He talks about how businesses and churches were shuttered and how the different communities were deeply impacted physically in terms of the spread of the disease itself, but also how they were impacted emotionally and spiritually afflicted by a plague which had literally taken on biblical proportions. You know, the Spanish flu ultimately infected over 1/3 of the global population. It killed 50 million people worldwide. There were 675,000 people in the United States alone that died from the Spanish flu. You know, this was a number that triples, quadruples, even some of the most extreme estimations that we've received from experts who talk about their projections of possibility for COVID-19 today. And you know, when I read this sermon, when I read it, and I was blessed to be able to receive this by Dr. Warren Dennis, a former professor at New Brunswick Theological Seminary, sent me a copy of it. It really seemed as if I was reading something that could have been written as a description of what we are seeing today, even right here in our town. Now, let me say this as a confession also from the beginning. I seek to be a careful student of history, but I'm not a historian. And I will say that some of my research inquiries have been challenged by our present day lack of access to some of our favorite local libraries, our university and our seminary libraries. And though I do give thanks to Kim Dorman and other people who have shared resources with me and have given me leads of where I might find more information, sometimes I have to say to you that information can seem overwhelming. There are times where, you know, I've had to remind my children that, you know, sometimes even I've had to remind other people that Siri doesn't know everything and that the best available research is not always right there at the tip of your fingers on Google or somewhere else online. You know, I will also say that we are in a time where we are subjected to these 24-hour news cycles that I try to avoid because they seem to offer more punditry and commentary than news that you can use. There are search engines that provide full-time access to rumor and innuendo and often bizarre and frequently unfounded conspiracy theory. And there are government officials that seem to traffic as much in so-called fake news as they condemn it. So what I'm going to do this evening is to try to narrow my focus so we'll just consider the legacy and the consequences to our local community, though we'll put it in a broader national context. What I offer to you tonight are at best some preliminary reflections, and I truly look forward to this community, to this Not in Our Town organization, to the broader community to continue this conversation. And I look forward to those who are more knowledgeable than me, who will fill in some of the gaps and will join us in moving this critical conversation forward. I believe that by studying the past, that the past can serve as prologue and that we can understand where we have been, we can make a better assessment of where we are right now, and we can more fully discover the possibilities of where we can go from here. So let's look back at the past. Let's look into what was happening in Princeton a little more than 100 years ago. You know, I was interested to discover that Princeton was hailed across the country as one of the great so-called success stories in their response to the epidemic of the Spanish influenza. Headlines and medical journals examined the strategies and the policies that were implemented here in Princeton to ensure that Princeton did not lose a single life, as it said. Yet, as I read a little more closely at the and went beyond the headlines, some of these headlines that were like, quote, why Princeton was spared. I noted that when these articles and reports spoke of Princeton, that they were more specifically and actually referring to the university. In 1918, at the end of World War I, Princeton University had almost become transformed into a military encampment as it functioned as a site of the Naval Paymaster School, which trained clerical officers in the war. And once the university had diagnosed its first case of Spanish flu on campus, and one of the young men that was enrolled in the Navy Paymaster School, they made this diagnosis on September the 5th, 1918. Then they immediately began to implement this very strict set of protocols and precautions and procedures that were designed to sanitize and protect all of those who were on campus. And by October, everyone who came into campus would have to have been, they had to strip off their clothes, that they took their clothes and they put them in a separate room overnight to be sanitized. They would be disinfected with barium dioxide, formaldehyde, and no, they didn't have anyone drink disinfectant, or get any kind of internal light therapy. But what they did do is they sprayed everyone's noses and throats with menthol and chlorazine and required everyone to take a bath before they would be permitted to come on campus. And the university expanded the infirmary. They expanded the infirmary in McCosh Hall on the university campus, and they used the university field house as a quarantine station for the more serious cases. Now, in this particular part of Princeton, south of Nassau Street, there were resources made available to those who were privileged enough to be sequestered there, sheltering in place. Just off of campus, even on Stockton Street, there was even a special influenza clinic that was set up to address the medical needs of those who were on the perimeter of the university. Yet as I began to dig deeper, it became very clear to me that all of Princeton was not spared. In fact, in Princeton, there were hundreds of diagnosed cases of the Spanish flu, of pneumonia, and by the time the country got to the end of the pandemic and the end was officially declared, that at least 32 people were officially diagnosed as having died from the Spanish flu. Now, my suspicion is that there were possibly even more. One of the things that becomes very clear when you begin to review the literature is, particularly this literature from the early 20th century, is that there is an expansive and obvious reality of institutional racism and segregation in Princeton and across the country, and in the coverage of what's going on in community. And in the absence of active Black-owned newspapers and other publications, full and comprehensive and remotely reliable coverage of what was and was not happening in Black communities is very hard to completely discern. The pandemic of the Spanish flu left newspapers, just as other institutions, in a difficult position. It was difficult for them to determine the full public health story, particularly in the Black community of Princeton, which was then and is today most densely populated in the Witherspoon-Jackson neighborhood, north of the university, north of Nassau Street, on the other side of Nassau Street. Across Nassau Street. Now we have some people here from our beloved Shirley Satterfield's family. This is a photo from 1933 from the Princeton Alumni Weekly, but.
Hey, Lukata.
Yes.
You're not sharing that picture.
Okay, so you're not seeing the picture. All right, let me go back to make sure we can do that. 1 second.
Let me know if you have any issues with that.
Share screen.
Okay,
right.
it's sharing now. You're good.
Are you seeing, let's see. You seeing the first image in terms of the title?
Yes.
Okay, and so now you see Shirley's family? Yes?
Yes.
Okay, all right. So this is an image of across Nassau Street. And you know we know some things about Witherspoon Jackson. We look in the history of our community. What we know is that significant portions of the Black community that were in 1918 in Princeton would have fallen to this category of what's called essential workers. And they would not have enjoyed the privilege of staying home, sheltering in place, or being protected in the sanitized sequestration of the university campus. They were day laborers, they were farmers, they were washwomen, they were cooks, they were maids. They made up the so-called, quote, peasant working class, just as the Black, but really the majority brown residents of our Witherspoon Jackson community are today. In fact, we know that in 1918 that the university and the town actually worked together to decree and enforce what might be described as even a quarantine of sorts of the Witherspoon Jackson community itself. And some reports we find that there was a decree that was issued from the university with the full support of the town, forbidding anyone on campus from entering into the communities north of Nassau Street and east of Bayard Lane. In fact, the students and the officer candidates were not allowed to even walk on the north side of Nassau Street. I'm going to try to show you a map. Can you see the map? Just give me a thumbs up, Valeria, if you can see that.
Yep.
We have a map here of the Witherspoon Jackson neighborhood, and many of you are much more familiar with the map of Princeton than I am, having only been here a year and a half, but this is Witherspoon Street right here, you know, which would go down. My church would be right here, Witherspoon Street Presbyterian Church, in between Quarry and Green Street. But you see Nassau Street right down here. And so this is north of Nassau Street. The Witherspoon Jackson neighborhood is north of Nassau Street. And this is Bayard Lane right here. And, you know, anything to the east of Bayard Lane was also an area that was restricted. It was an area where there was no entry, where those who were on the campus, they were not allowed to go into this area north of Nassau Street, east of Bayard Lane. And so we see what this community is. Now, we also know that the people who lived in this community would not have had the same sort of access. They wouldn't have had the same access to all of the resources that were available to those that were on campus. They wouldn't have had access to medical and health facilities that the majority privileged population enjoyed. People of color 100 years ago and people of color today continue to face disparities in terms of access to healthcare, as well as within the broader intersection of socioeconomic realities, which have a direct impact on the quality of life. Essentially, what these communities had to do was they had to take care of themselves. They had to fend for themselves. They had to do for themselves. They had to provide for themselves. And so we had a community that was separated from the privilege, a community that was separated from the resources, that was restricted from receiving all of the different protections that ultimately resulted in Princeton University not losing one single life. And this was a reality all around the country. This was a reality in Black communities all around the country, and cities across the nation. If we look from 1918 to 1920, which is the period where the Spanish flu was said to have covered, Black people who were struck by the flu were left to fend for themselves. And when they did so, they often had substandard care in segregated hospitals. They might be relegated to very close quarters. There was no 6 feet distance in basements, or they were only allowed admittance to the very few Black-owned hospitals that existed around the country. Even in death, the Black bodies were were neglected and put aside by the white public infrastructure. In the city of Baltimore in 1918, white sanitation department employees actually refused to even dig graves for Black flu victims after the city's only Black cemetery could not accommodate any additional graves. And so it shows us something that exists within the conventional wisdom of our communities in many ways. And I know some of you may have heard this before, and for some of this, it may be new to you, but it's been said that when white folk catch a cold, then Black folk get the flu. And when white folk get the flu, then Black folk get pneumonia. And when white folk get pneumonia, then Black folk die. And this is something that has been a part of the conventional wisdom in both the Black and the white communities. But I have to say that it has been the conventional wisdom when we look back historically for different reasons. Now, in certain sectors of the white community where you had this white supremacist science and junk science, this type of conventional wisdom was connected to the idea that Black people were biologically inferior, that they were more likely to actually be vulnerable to disease, they would be vulnerable to certain types of health ailments like tuberculosis or flu or pneumonia, because they were physically inferior, because they were physically weaker. And there's a long legacy. There's a long legacy within the medical community going back into times of slavery where medical science was put forward as a justification and a rationalization for why the public health of the Black community was where it was. I was looking at one particularly disturbing example that goes back to March 12th of 1851, where there was a noted physician named Samuel Cartwright, who had reported to the Medical Association of Louisiana that he had actually identified a medical illness, a malady, which was why Black people actually tried to escape from slavery. That it was because they were physically ill, and he came up with this sickness, which he called drapetomania. And drapetomania was a mixture of two different Greek words, drapetus, which means the runaway, and mania, which means madness, and said that it was because of a biological, physiological dysfunction. That it was the reason why all of their Black people were running away and were escaping from the horrors of slavery, and that perhaps that what they needed to do was just treat them okay and treat them a little better, maybe give them a little bit religion, and then the Negro would be spellbound and could not run away. And so this is the legacy of this white supremacist science, and that legacy of science put forward the idea that the reason why Black people were affected by disease in certain ways was because of their genetic inferiority. But what I want to submit to you is that there was another explanation. There was another argument that was put forward even back as early as 1899. We see the work of W.E.B. Du Bois. And Du Bois was challenging this false science. And if we truly understand the scope of Dr. Du Bois, we see that he is truly the father and the founder of social epidemiology, which connected the realities of public health with the intersection of race, of class, of gender, and immigration. He put forward this idea with some incredible scholarship that the reason why Black people were subject to certain types of disease and higher levels of morbidity and mortality rates was because of broken social infrastructure, because of systems and conditions that people were living in that led for certain types of prevalence of certain types of diseases. And even today, this is what we're seeing. You know, when we look at the discussions with COVID-19, in 2020, the Center for Disease Control and Prevention has found that when they look at the morbidity rates, the infection rates, when they look at those who have been tested positive, when they look at those who are dying, that there is a disproportionate number of racial minority groups that are accounting for the cases and the fatalities, and the Black community in particular is suffering the most. In Wisconsin, a state that is only 6% Black people account for half of its COVID-19 deaths in Chicago. Black people account for 70% of the deaths due to COVID-19, but only make up 30% of the population in Richmond, Virginia. All but one of the people who have died of COVID-19 were Black. You know, we recently, I think on the 22nd of April, the governor of New Jersey, Governor Murphy, has put forward an order that we will start collecting this information more comprehensively about race, and as we're analyzing the data for New Jersey and COVID-19, some of it was already being collected, but what we already know from all of the statistical information that we have and the anecdotal information that we've received is that these structural inequalities that have kept Black communities and brown communities significantly poorer than their white counterparts are creating certain health disparities, and these things show up in a particular way during a pandemic. Black people and minority populations tend to live in more polluted, more densely populated areas. They have more people per household. They are overrepresented in settings where people who are unable to effectively put in place these social distancing, and whether that be in prisons or in homeless shelters, they are disproportionately working these jobs that are considered essential. Just as in 1918, there were farmers and day laborers and washwomen and maids and cooks that had to go out. And I'm still trying to get information for the cooks and the people who clean the university. I wonder what type of treatment they had in terms of the sanitation and what type of regimen that they went through. But I would say that when we look at it then and we look at it today, we have people, whether it be in the Black community and the brown community, that are far less likely to have access to paid sick leave. They cannot afford to take days off or weeks off or months off of work. They do not have grocery stores that are nearby and easily accessible, or the resources where they can stock up easily. And many of these communities, which are food deserts, are also communities where there's a lack of health insurance, which when you add it all up, it means Black and brown communities are going to suffer at higher rates of acute and chronic medical conditions. You know, Dr. Vanessa Northington Gamble, a medical doctor and a professor of humanities at George Washington University in Washington, D.C., said, "Who you are, and I mean in terms of your race, your gender, where you live, and I'll also add to that your documentation status, your immigration status, will have a major role in how you experience COVID-19. It will also play a major role in the services that you get, and it'll play a major role in the services that you are unable to get. And if there's anything that we can learn," she says, "from the 1918 influenza epidemic, is that we really have to look at issues around race and class and racial and social inequalities." And everybody can see Brother Robeson with his mask on. You know, and we might think that the more things change, the more things remain the same. But it's interesting, in my research, I found there was something different about the Spanish flu. That when you look at the history, that Black people actually had a lower morbidity and mortality rate with the Spanish flu. You know, there's a researcher, Alfred Crosby, noted that this norm changed for the first time during the 1918 influenza pandemic in the United States. The Black population, which was expected to have higher influenza morbidity and mortality rates, actually had lower rates than the white population during the fall of 1918. And I want to just talk a little bit about that, because I think it's important for us as we think about what's going on right now in our community and what's happening in Princeton and what's happening around the country. You know, many of us are saying, "Oh, when is this going to be over?" We had a president that said that everything was going to be open by Easter. You know, it got moved back a little bit. I think, you know, May 15th, I heard there have been some more changes even today that put the dates even further back. but we're all very anxious to be able to get back to normal, to be able to get back to doing what we're doing. But when we look at the history of Spanish influenza, we see that it actually occurred in 3 waves. That the first wave was in the spring of 1918 and in the summer of 1918. But then the most deadly wave actually came during the flu season that came in the fall and the autumn of 1918. And that is when most of the 675,000 people that perished in the United States, that's when their lives were lost. It was in that period, September, October, November, going into the winter. That was when most of the lives were lost. And so as much as we expect that this will be over on May 15th or over in time so we can get back to the beach in the summertime, we have to be mindful of the history of what the pandemic looked like in 1918. And one of the theories, and I'll say it's a theory because it's difficult to pull together a lot of the medical research in order to truly affirm it, is that the reason why Black people had a lower morbidity and mortality rate with the Spanish flu was because the earlier wave in the spring was milder. It was a milder strain of the flu, and that by the time we got to the fall, it had mutated and it changed, and it was a more aggressive sort of strain. And the people who had actually been especially well protected and especially well privileged had not been exposed to the milder strain. And so in that they weren't exposed to the milder strain, when they were hit with the more aggressive strain, that's when you had an expanded number of deaths from the Spanish flu, particularly in the white community. Now, I want us to remember that the Spanish flu pandemic infected 1/3 of the global population, killed an estimated 50 million people, 2.5 to 5%, it says 50 to 100 million people, 675,000 in the United States. And the only year in the 20th century when Black people in the United States actually had a lower influenza mortality rate was in 1918. So it gives us some things to think about as we look forward to how long this COVID-19 pandemic may be with us. We don't know all of the reasons. I certainly, as I listen to some of what I hear and read of what I hear, it seems as if information changes every single day. I remember when they told us that we shouldn't wear masks. I don't know if you all remember that masks were unsafe, that masks were unhealthy. And then there was a shift. Oh no, now everyone needs to wear a mask, and you can't actually even go into certain places if you aren't wearing masks. But I think that we need to take some time to think about what we've learned before and where we are today. Because today we have some similar dynamics. We have a community in the Witherspoon Jackson neighborhood that is largely the peasant working class of Princeton of today. Largely a Spanish-speaking and a Guatemalan community. It is a community that continues to provide the essential services. If you are in the Witherspoon Jackson neighborhood, and it's always an interesting mix. I see a group of people, and some are walking their dogs, and some are taking lovely strolls to the neighborhood, and I see others who are clearly waiting on the corner as day laborers, waiting to be picked up so they can go to work and they can find work. And there are others who are going back and forth where they're having to continue to provide services somewhere, somehow. There is a level of desperation. And we have to see that this community is being affected and impacted. And what we have to do is not say, okay, we're going to quarantine it off. We're going to section it off. We're going to leave it where it is. We're going to go and we're going to shelter in our comfort and in our privilege. We have to discover, what should we do now? We're a different people, I hope. We have a different level of understanding and consciousness and conscientiousness 100 years later than we had 100 years ago. What should we be doing in relationship to our whole community, to our entire town? I've been blessed recently, and this, let me just say this. This is one of the things that Reverend Grimke talked about quite a bit. He said in 1918 There were all of these things that we had to learn. There were all of these lessons that were to be revealed. There were things that we learned about race. There were things that we learned about class. There were things that we learned about health. There were things that we learned about faith. And I believe that this is a moment, this is a time for us to be asking questions and looking for answers and solutions that solve. But I was blessed to be able to see that there are some good things happening, even in the midst of the bad things that are happening. Yes, we have a situation where we have people who are struggling within certain communities more than others because they cannot afford to be off of work. They are a part of the essential class. They are subject to wearing certain disposable masks. Sometimes I was talking to someone, they've been wearing the same disposable medical mask for over a month, which at this point, that mask is probably dangerous to them and even to their family. And they're in need of changing out the new mask. It might be better for them to pull this one off of the bust of Mr. Robeson. But we have some good things that are happening. Witherspoon Street Presbyterian Church has been blessed to be able to work with an organization called Unidad Latina en Acción, New Jersey. And one of the things that we were able to do is we were able to help for those families and those day laborers that needed help with their rent. And I'll show you a picture. We were able to work with them, and they were able to distribute $10,000 to help people pay their rent on May the 1st. And we were able to work with a local business owner that opened up her store and allowed people to come in and be processed day laborers so they could be able to pay their rent within our community. We were able to connect with organizations, and there's great work being done out of the university. There's a group of graduate students, and they've formed a group called Princeton Mutual Aid Group. And this Princeton Mutual Aid Group has been working with communities, been working with Unidad, and been distributing food to families, birthday cakes to one-year-old child, toys, diapers, formula, all types of things. But we have to recognize that we cannot be sheltered and separated away from one another, though there is a call for social distance. We have to recognize that it is important that we be connected one to the other, that we have to see that there is a legacy, and that legacy is this. It is very possible to put yourself in a great position to be safe, to be protected, to be sheltered in place. If you have the privilege of being able to stay at home, if you have the privilege of and I know some say, how is that a privilege? I'm ready to get out. I want to get out in this beautiful weather. But if you're able to be able to do that, if you're able to store up food, if you're able to have reserve income, if you're able to do these things, but we have to remember that there are communities that are still here today that are isolated, that are marginalized, that are separated. And what I hope that this conversation will begin, and as we go into some of these breakout rooms, is that we will begin to talk about how we can begin to support one another. I think that I've been so impressed with some of what I've seen from our mayor, from Princeton. I've been impressed with what I've seen from local community organizations and newly formed groups like the Mutual Aid Group and Unidad, New Jersey, which is not new, but I think that we need to put more pressure. I want to encourage you and invite you to put pressure on your churches. Put pressure on your synagogues. Put pressure on the ummas and the masjids. Put pressure on the temples, because we all need to have all hands on deck. We have tremendous resources, and we can be another Princeton success story. We've already had, I think the last count I saw was on May 1st that there were 10 lives lost in Princeton. I don't know if that number has changed, and we're praying for all of our families. We're praying for all of those that are lost. But I say that we have a responsibility and an opportunity to actually come together and say, not in our town will we do the same thing that we did 100 years ago. Not in our town will we make the same mistakes and fall into the same practices of privilege that we fell into 100 years ago. That we will speak up, that we will speak out, that we will listen to our neighbors, that we will collaborate. I'm not talking about mere charity or that's why I like the group mutual aid. How can we support one another? How can we encourage one another? How can we support one another? How can we be in partnership with one another? So I thank you all for being a part of this conversation. I thank you for being interested. I thank you for being committed to learn lessons from the past so that we can move forward and not repeat the same mistakes. Past can be prologue, but as Malcolm X said, history is oftentimes the best qualified to reward our present day research. And so looking back, we can find the right way forward. Thank you. And may the 4th be with you. The one who is marginalized and on the outside. Privilege actually is poisonous. Privilege is something that degrades you morally, ethically, spiritually. I even think, and again, the science is not clear on it, but I think that some of the privilege that sequestered certain privileged communities in the early phases of the Spanish flu in 1918 potentially led to them not being as prepared to actually even deal with some of what came in the fall. And so, I mean, I think that there is, we have, I could cite from multiple sacred texts, but what is it profit a man? To have everything, to have abundance, to have wealth, to have privilege, and lose their soul. And so I think that that's what we have to gain. That as we begin to create a more equitable and balanced and humane society, that we have the opportunity to fully become the human beings that we are supposed to be.
Great. So the next question is, how can we use community organizing to bring us together and reimagine/reinvent our society post-pandemic?
Well, I think there's a lot of ways to answer that question. I want to go to some of what I said about some of the topics that I missed. One, we need to deal with what's happening in our prisons, and we need to be using some community organizing strategies with that. So many of us have people that are connected to our families or connected to our communities that are a part of that incarcerated population. We need to be organizing and mobilizing letter writing campaigns, writing letters to the governor, writing letters to the commissioner of the state of New Jersey, of our prison system, and communicating our outrage and communicating our concern, because these prisons have become petri dishes, for COVID-19, and you're finding some of the highest levels of infection and positive testing inside of these facilities. Men's prisons, women prisons, it is something that, using the power of the pen and the time that we have and emails is something that we need to be doing. But as a community organizer, before I came into the church, and I talked about this to my church, I've talked about it a couple of times. I was in Atlanta from 1989 to 2000, and I only went to church on one Sunday the entire time I was there. But I was in, and I had not yet accepted my call to ministry. I was called as an activist and a community organizer, but I was in church 3 or 4 days a week because we had empty buildings that were not being used in the ways that they needed to be used. So there were clinics that we could organize, there were food programs we could organize, there were testing centers that we could be organizing now. And I would just ask, call on your faith leaders, and I say, bring it on us. Call your pastors, call your rabbis, call your imams, call your leaders in your Gurdwalas, call all of our leaders, knowing we still don't know what we're doing. Most of us have never had to lead anything in the midst of a global pandemic, but they need to know that you have an expectation that we are going to begin to organize in our community. The most important part of community organizing, though, is what I said before, is listening. You have to listen to the people and let the people tell you what it is that they need to do. And in our privilege, don't think that we need to lead them. and we need to tell them what they need. You know, some of our answers do not answer. Some of our solutions do not solve. Some of the programs that we have, they're not eligible for, or they're afraid to even try to participate in that for good reason. And so we have to try to navigate and to figure out how we make it through and to where we're supposed to be by being in real community conversation and in partnership. This has been a beautiful gathering. I mean, we had, you know, probably over 100 something people, because I see multiple faces on some of these screens, you know, but there are probably some other faces and some other languages and some other contexts that need to be included. And we have to begin to do that work.
So the next question is about the protests that have been going on in terms of protesters wanting to reopen their states prematurely. So in terms of that, what would be a response to people who go out and actually physically go protest, trying to reopen their states prematurely, and how to make them understand how that would directly impact not only them, but the communities around them that support them and actually let the American economy go on?
Well, the first thing I would say is study your history. Look to what happened in Philadelphia in 1918, where they decided that they were going to move forward with this planned march to celebrate patriotism, and they had 200,000 people who gathered, and it was the context out of which Philadelphia came to be rocked by Spanish influenza, because they decided they were going to do what they wanted to do. They were going to go ahead and follow through with the plans that they had. And there was a march that 200,000 people gathered in Philadelphia, and there was huge consequences that the people suffered as a result of that decision. Now, that being said, I also will say I understand those who want to be able to get back to work and those who need to be able to get back to work. But I also understand there's a very real problem when I look at states like the state of Georgia, and Governor Kemp decides that he's going to open up a couple of Fridays ago, I think it was, and he's opening up barbershops and beauty salons and places where you can get your nails done and tattoo parlors, opening up those particular types of businesses that will be likely patronized by people of color and lower income people. It's you know, Stevie Wonder could see it, Ray Charles could see it in terms of what it is that's happening in some of these situations. And so we need to be as angry about that as some of these privileged folks. I can't imagine that as a Black man I could walk up to in a state capitol, in a government building, with a rifle or with a shotgun. I'm scared walking around with my mask sometimes in Princeton. You know, it's a different state of reality. I'm like, you know, I see people walked across the street and maintained a 6-foot distance before when I was walking down the street. And so now when I'm walking down in Princeton, I have on a mask and I don't have on my clerical collar. You know, it's a whole different type of reality. So, I mean, I also think it's unfortunate that we have a president that is feeding into that, and which is what the history has been, I think. But I think that we have to be students of history. And we also have to say, okay, so if this continues in waves, the Spanish flu lasted 26 months in the United States. Just sit with that for a minute. Imagine if we have to do this for 13 months, half of that. There is some massive work that we're going to have to do. And this is the thing. On some level, it was likely functionally easier for the American government infrastructure and the local infrastructure to manage it, because there were such large groups of people that were completely marginalized and isolated that they weren't going to be worrying about taking care of anyway. And we have a different reality. We you know, 100 years later, we're a little more enfranchised than we were 100 years ago. And we have more representation. When I say we, I'm talking about low-income people. I'm talking about people of color. I'm talking about people who are going to make demands. But we're going to have to figure it out. And Valeria and I were talking about, they said, if people didn't believe in health care for all prior to this, they never will. And we just have to move on and figure out another strategy. because we have to start to imagine. I mean, I think many of us would say, okay, if I can just hold out another month, if I can make it to May 15th, if I can make it to the summer, if I can make it even to the end of the year, imagine if you have to make it to the end of next year. What does that look like? For you individually, for you in terms of your family, and in terms of our communities. I have to think about that. I talk to my leaders in my church to say, we have to think about this. It's not going to be next Sunday. We're not going to be in church on Easter. So we have to make plans for what we are going to do and how we're going to still be at church, how we're still going to be the ecclesia, the called out body of believers. What does that look like without access to a building in the same sort of way? And do we need to be using our building? I mean, because we have more than capacity to be able to we have sanctuaries. 6 feet distance is easy. You know, we have, and not for worship services, I'm talking about for community services. When they need to have testing centers set up, when we need to have clinics set up, when we need to have certain facilities set up for community, we have empty buildings all over our communities that we need to think about. How are these potential resources, can they be mobilized in partnership with the government, in partnership with community-based organizations, in partnership with local neighborhoods?
Great, thank you so much. I think we'll be wrapping up now, but thank you so much for joining us. Thank you so much for coming and speaking and sharing all of your knowledge and your thoughts, as well as Princeton's history with the response. One thing before everyone signs off, make sure that you check out the Not in Our Town Princeton website, which is NONIOT-Princeton.org, and our social media to keep up with other opportunities such as these. And I think Shelley wanted to say something before we all signed off. So
you really mostly said it just now. I know that some folks are here with us tonight for the very first time, as is usually the case. We just want to let you know that Not in Our Town Princeton is committed to continuing to provide these kinds of opportunities to dig into, at a personal level, the societal inequities that are visited upon people of color in this country. And we want very much to be part of a continuing conversation, and that's why every Monday, first of the month, last month was the first time in a long time that we haven't had a session. We're very grateful for the partnership of the Princeton Public Library, and we just want to encourage everyone to come back, to bring a friend, to continue to dig in and have these challenging, enlightening conversations, because we need to be in it together, and we're very grateful for everyone's support and for taking the time out to be with us tonight.
And next month's program on June 1st will be the racial literacy class at the Princeton High School. We had students and the co-teachers, one of whom was one of our facilitators, Dr. Joy Barnes-Johnson, and her co-teacher, Patricia Manhart, and some of their students come to present, and we'll have the chance to do that again June 1st. So we hope that you will come back for that. Thank you again, Reverend Mjumbe. This was a wonderful way to begin our virtual existence, and with many ideas to take it into the world when we can be together again.
Thank you.
Thank you.
Thank you.
Thank you, Rev Lukata.
Thank
Bye
you.
now.
Thank you.
Thank you all. Thank you, Valeria.
Yes, thank you, Valeria.
Thank you, Valeria.
Thank you.
Cam, Linda, Mickey, Joyce. Thank you.
See you later.
Bye-bye.